How are you? Good morning. What is your name?
Raymond.
Oh, nice to meet you. My name is George Reyes. I'm going to be your nurse practitioner for today and for the next following weeks. And Dr. Joe asked me to do an assessment on you. So
Okay.
the first thing is that I'm going to meet with you in the next following weeks. We're going to meet in this office around 3 p.m. once a week. If you need to contact me during that week, you can call my office or you can do a voicemail that the number that I'm going to give you at the end of the session. Can you tell me what is the main reason why you are here?
I lost my wife 6 months ago. I've been drinking a lot of alcohol, more than usual, just to get myself to sleep.
What happened to your wife?
She died of cancer.
For how long she was sick?
She was sick for a year,
How long you were married?
13 years.
How many kids?
We have one son that is in a different state.
So, so are you living right now by yourself or you have some kind of family member with you?
I live alone.
How is your mood?
I feel very lonely. I don't have much friends. My wife was my friend. Um, I find it very hard to sleep sometimes too because I'm by myself
Do you live in your house or apartment or you're renting?
in my house. Yeah, I have friends, but I don't talk to them. They're mostly my wife's friends.
The drinking problem that he told me that you were having. Are you drinking now?
Yeah, I drink 6 pack of beer in the evening to help me stop thinking and fall asleep.
Before, when your wife was alive, you were drinking as well?
Not that much.
Have you ever had any problem with alcohol?
No, I never had any problem with alcohol. I usually drink with my wife one glass of wine with dinner, but ever since she died, I just drink more than usual.
This is something new for you, the drinking.
Correct.
And when do you start to drink the 6 pack every night? For how long you have been drinking that?
A month or two before she died, I started.
And she died 6 months ago, right?
Yeah.
So tell me how you feel when you are drinking. You think that helps?
I mean, it makes me get drunk and then I fall asleep, so it does help.
But do you know that if you're drinking that much, you can have problems in the long run?
Yeah, but for now, I think it helps, so I'm not sure what else to do.
How old are you right now?
I'm sorry?
How old are you?
I'm 70.
I mean, you said that you are drinking for 3 months, and you said that that helped you to forget what happened to your wife. But do you think that there is any other way that you can do something about it? Or
I don't know any other way.
know that there was some kind of help that you can have so you can mourning a little more easier?
No.
Because I suspect that after that many years that you were married, you were very attached to your wife. How good relationship you have with her? You were getting along. You were getting along well with her.
Yeah, we had a good marriage. No.
Basically, she was a really good friend with you.
Yeah.
Um, have you ever tried now that to go out and try to see if you can make some friends?
No, I'm too depressed to do that.
Besides the drinking that you have, do you have any other um, change in your behaviors or in your mood lately?
I haven't been eating well because I just don't know what to eat, and I was never the one that cooks the dinners.
And from 0 up to 10, how sad do you feel?
Sometimes 10, sometimes 8. It fluctuates.
Hobby or some interest, or you are completely lack of interest to do things outside your house?
I used to be a carpenter, so I have projects that I used to do, but now I just stay home.
How is your appetite?
I hardly eat. My wife used to be the cook, so I don't really cook anymore.
So how, if you don't cook, how you eat? You,
Sometimes I order food and sometimes I just don't eat.
so you have been losing some weight lately?
Yeah.
Do you know how many pounds you have been losing?
No, I haven't been to the doctor.
But can you see the difference between before and now about your weight? Or you
Yes,
can,
I've been losing weight, but I don't know how much.
okay. What about sleeping? How do you sleep?
When I drink alcohol, it makes me sleep.
But if you don't drink, you don't sleep.
No.
Do you wake in the middle of the night?
Do I what?
If you do you awake in the middle of the night?
Sometimes.
Do you have any thoughts when you are waking and thinking
Yeah,
about?
that's why I drink to help with my thoughts.
Do you feel fatigue, tired all the time?
No.
Do you feel guilt for what happened to your wife?
No, there's nothing I could have done. She had cancer, so
And where she was has the cancer? What area of the body?
she had breast cancer.
Does she receive treatment?
She did, but it was too far gone, so they couldn't do anything else for her.
They given chemotherapy at the end,
They did.
and you were with her all the time.
I tried to.
What about your the? Are you able or capable to concentrate to do one thing, or you just don't pay too much attention because you get distracted very easily?
Sometimes I stare up into space. The other times I'm okay.
You make any decisions at this moment what you're going to do?
No, I don't. I haven't thought about it.
Do you have any plan
No, I haven't thought about it.
about how is going to be your life in the next years? You don't have any idea what is going to do, what you're going to do?
No, I haven't thought about it.
Do you have any thoughts of suicidal thoughts to kill yourself?
Sometimes I want to be with my wife.
When was the last time that you have those thoughts?
Last night.
Have any plan to do it?
No,
You have been thinking to do certain things in order to kill yourself.
no. I only thought of killing myself because I want to be with my wife. I don't think of anything else.
You know that drinking that much can kill you. I mean, if you are drunk, you know that when you are drunk, you can have some kind of accidents. This is one way for you to that you have been planning to kill yourself by drinking a lot. You get drunk.
I only drink to sleep. I don't drink to kill myself.
How is your mood? Do you have any kind of outburst, or are you violent, verbal or physical, with people who are around you?
I try not to go around people because I'm so angry that I lost my wife.
Basically, you stay at home all the time.
Yeah, I stay at home all the time.
You don't go out.
No.
Okay, for what I see, there are three things that we have to be careful, okay? One thing that is important is that if you keep drinking, you know that when you're drinking a lot, you're going to have some problems in the long run. Are you aware of that?
Yeah, I know.
Okay, so I think that if you keep drinking as you are doing, that is going to be a problem in the long run. Secondly, that I see that you don't have no plan of what you're going to do. I mean, I know that losing your wife was a big deal, and for sure you have to feel sad, and this sadness is going to last certain period of time. Sometimes can be last 6 months, sometimes can be a year, depends. But we have to find a way for you to be busy. because it's important for you to keep your mind away from the thinking of what happened to you. So we have to make a plan to see what we are, how can I help you to do certain things, okay? And I have to work with you. Are you okay with that?
That's fine.
What is important is that we have to make a contract, because I see that you have some thoughts of kill yourself. So by doing this plan, we are going to make a contract that you're not going to kill yourself, okay? For sure it's important, and I know that it's difficult because this age, sometimes it's difficult to overcome the death of the wife. But we have to make this plan so I will be more secure that you're not going to kill yourself. Are you okay with that?
That's okay.
The last thing that I'm going to do also is that first I have to see that you don't drink anymore, because I would like to give you some medications. But the medication with the alcohol, they don't go alone. So I have to see how you're doing with your drinking, and in order to do that, I will going to refer you to see some kind of a specialized counseling for drinking problems, so you can work out and you can learn how to do other coping skills to stay away from alcohol and do activities during your day. Are you okay with that?
Okay.
Okay. Do you have any question at this time?
Is there any way somebody could help me with food?
Yes, I'm going to refer you to the social worker that we have here in this office, and maybe she can help you to make some contacts with the community, because there are some places that can send you food. I mean, cook food, and because of your age, I think you are entitled to receive that kind of help. So I'm going to talk to her, and I'm going to refer you to her. Okay, her name is Laura. Okay, and I think she's going to help you with food. So it will be good if you try to make some friends. How it will help you. And the best thing to do is to try to attend some groups. I don't know if you have any groups around your house where you can go with people of your same age, and you can spend some time. If you don't, I'm going to talk to the social worker, and she will give you 3 or 4 different places where you can go to play bingo or to do some kind of activities during the day with people of your same age. Are you willing to do that?
Okay, that's fine.
Also, I know that places like a YMCA, they offer, exercise, dancing, painting, all these activities that you can join them, because it's important that you keep your mind busy during the day. So at night you will feel tired and you don't need to drink in order to forget, in order to fall asleep. So those little things I think are going to be part of the plan, the treatment plan that we are going to write with you. And I hope it's going to help you in a different way. Okay?
Okay.
I would like to see you next week, if that is possible. Do you think that you can come back next week?
I'll try to see if I could get a ride because I don't have the money.
Well, if you cannot get a ride, let me know. You can call me and I can see if we can send you a ride from Medicaid, okay? Because they have this shuttle where you can send the shuttle to the place of the patient. They can pick it up and they can drop you off, okay? So I would like to also to work with the social workers in order to find you a transportation. I'm going to give you all my phone number of the clinic, how you can contact me. I'm going to give you the name of the social worker. We're going to do the treatment plan that you have to sign with me. And I hope that, remember, the most important thing right now is that you have to try by yourself to stop to drink. That is the most important thing, okay? And by tomorrow, the social worker is going to contact you so you can start to work and see what we can do during the week. So I hope I can help you, and I see you next week. Okay?
All right. Thank you so much.
Okay, thank you. See you.